Good afternoon. It is a great pleasure to be here answering all the questions that were actually intriguing some of you. I think that a diabetic patient, especially in this moment of lockdown or locked in and quarantine, should really make sure that some of essential steps of their own personal treatment, their own looking after, is regularly followed. So it is not just about taking the correct treatment and follow the treatment correctly. It's also about choosing and endorsing a correct lifestyle and at the same time also looking after their own oral health. In fact, I would say, we as specialists, we are expecting a sort of a potential increase of inflammation in the gums of our patients in this moment. These are not easy moments. They're very stressful. They're very intense. It's going to be a very important period of all our own lives, really. And surely for some people that are affected by chronic diseases, these periods are really indeed even a higher challenge. So surely what is really important is to have a correct lifestyle and at the same time to look after their own oral health. In terms of correct lifestyle, I would surely support the strengthen their own physical activity and try really to take advantage of any possible opportunities. I personally walk on the stairs of my buildings up and down every day for at least 20 times. Then I just downloaded two apps. One on the steps is just a pacer counter to make sure that at least I go above 5,000 steps per day, which makes me, of course, a sort of a ghost moving around the house all the time. But another one, which is instead of just some sort of an online training, something that you can do with a bit of gymnastics with your own body without weights, but just to make sure that your body is moving and your muscles are not going in atrophy. And at the same time, we're trying to make them as strong as possible. Then surely I would avoid smoking very much, especially in this moment when a respiratory infection is really going around. And most importantly, I would make sure that I will try not to be extremely stressed. So that's, of course, not easy in the middle of a pandemic, but I would try to make sure that I follow what I'm being told to follow by the institution. And I would most probably avoid to watch every day a sort of a continuous bombardment of news, but try to focus on your own things. Try to find the time for yourself that normally you don't have the time to. So I would read a book. I would just play an instrument. What I'm actually trying, I just took out my very old guitar and try finally to play again, just to devote some time to yourself. At the same time, oral health is crucial. And I think, especially now, when no periodontist, no dentist can look after a patient, it is important that the patient, in a way, is doing the correct thing. So first of all, I would say surely to clean in between teeth. So interdental brushes are crucial, and I would focus on trying to use them and to clean in between teeth every day, at least twice before brushing. Then I would go for brushing teeth, and I would support the usage of an electric toothbrush. And then I would not exclude in this period also to make some rounds of some mouth rinse. I would like to have the mouth as little inflamed as possible in this moment, just to make sure that whenever it will be possible, my dentist, my periodontist can actually check out the situation and possibly compensate for some lack of maintenance or lack of care. This is even more true and even more important when somebody actually is affected by diabetes, because we know that the subject affected by diabetes have a higher chance to develop gingival inflammation. But it is also true the opposite, that people with actually periodontitis may also even show a deterioration of their glycemic control. So surely what we have here is a situation where one benefit the other. So by looking after the gum, you might actually even have an impact on the metabolic system. So really, my suggestion for your own oral health in this moment is to clean in between the teeth, try to brush as well, both time, twice a day, and then use a mouth rinse.